Assalamualaikum and hi. In the medical profession, there are so many branches and specialties. Well, I am interested in radiology. Specifically, I am interested in becoming a musculoskeletal radiologist. Then let's get to know about the musculoskeletal system. In the musculoskeletal system, the muscular and skeletal systems work together to support and move the body. The muscles of the muscular system attach to the bones, pulling on them will allow movement of the body, while the skeletal system serve to protect the body's organs, support the weight of the body, and give the body its shape. Let's get deeper into the skeletal system. So this is the human skeleton. As you can see, there are two colors there. Blue represents axial skeleton, while red represents appendicular skeleton. The axial skeleton consists of the skull, which protects the brain and supports facial structure. The vertebral column, which is the spine, surrounds and protects the spinal cord and support the head, while the thoracic, which is rib cage, surrounds and protects the organs within the chest, including heart and lungs. The red one is the appendicular skeleton that consists of the pectoral girdle, shoulders, upper and lower limbs, which is the arms and legs, and finally the pelvic girdle, which is hip bones. The major functions of the human skeleton is to protect the internal organs, supports and gives shape to the body, allows for movement, and become the site of blood production in the marrow of some bones. Next, let's get deeper into the muscular system. Here you can see the structures of the muscles. Skeletal muscle is innervated by the somatic or motor nerves to stimulate voluntary movements. Skeletal muscle fiber cells are narrow but can be long, and each fiber has its own connective tissue covering called the endomysium. The muscle fibers are in bundles known as fascicles, which are held together by a layer of connective tissue called the perimysium. These are grouped together to form muscles bound by a sheath of fibrous connective tissue known as epimysium. The skeletal muscles are antagonistic. They work in opposition to each other to create movement. When skeletal muscle receives a signal from the somatic or motor nerve, it shortens, pulling one bone towards the other. As one muscle in the pair contracts, the other muscle relaxes. The process is then reversed to strengthen the bone joint. The skeletal muscles requires 4 key properties. First is contractility, so it contracts to produce forces sufficient to move the bone. Second one is extensibility, ensuring it is able to stretch without being damaged. The third one is elasticity, which allow it to return to its resting state after being stretched or contracted. And the fourth one is excitability, so it is able to respond to a stimulus upon receiving action potential. So, the key functions of skeletal muscles are maintaining posture and body position, producing movement, helping in the return of venous blood from lower limbs to the right side of the heart, and the last one is converting chemical energy to mechanical energy, which generates heat and contributes to the body's temperature. Next, let me explain a bit about the mechanism of the muscle contraction. The contraction of the muscle fiber is initiated in the neuromuscular junction which is the chemical synapse formed between the nerve fiber and the muscle fiber. The nerve into the synapse between the muscle and nerve fiber releases acetylcholine, which acts as a chemical neurotransmitter to convey the electrical impulse from the nerve to the receptors in the muscle. When a muscle fiber receives a signal from the nervous system, myosin filaments are stimulated, pulling actin filaments closer together. This shortens sarcomeres within a fiber, causing it to contract. Here we've got the musculoskeletal system related diseases. The first one is rheumatoid arthritis. It is an autoimmune and inflammatory disease, which means that the immune system attacks healthy cells in your body by mistake, causing inflammation, which is painful swelling in the affected areas of the body. In a joint with rheumatoid arthritis, the lining of the joint becomes inflamed, causing damage to joint tissue. This tissue damage can cause long-lasting or chronic pain, unsteadiness, and deformity. The treatment of rheumatoid arthritis usually includes the use of medications that slow disease and prevent joint deformity, called disease-modifying anti-rheumatic drugs. We also can manage rheumatoid arthritis with self-management strategies proven to reduce pain and disability, allowing them to pursue important activities. For the second disease, we got osteoporosis. Osteoporosis is a health condition that weakens bones, making them fragile and more likely to break. It develops slowly over several years and is often only diagnosed when a fall or sudden impact causes a bone to fracture. Osteoporosis is not usually painful until a bone is broken, but broken bones in the spine are a common cause of long-term pain. The treatment of osteoporosis includes regular exercise that can strengthen the bones and all the tissue connected to them. Next is taking vitamin and mineral supplements according to the appropriate prescription from health providers. And also medications such as hormone therapies like replacement estrogen or testosterone also can help with osteoporosis. Now let's move on to the last part, which is the world-known musculoskeletal radiologist. First one is Robert Downey Boughton, which is a radiologist and a clinical professor. Robert Downey Boughton works clinically as a musculoskeletal radiologist, interpreting a broad array of diagnostic imaging examinations, most frequently MRI, CT, sonography, and radiography. He also served as chair of the Musculoskeletal Imaging Program Committee for the largest medical meeting in the world and is president-elect of the Society of Academic Bone Radiologists. Next one is Dr. Khairul Anwar bin Saad or Abdul Halim, which is a radiologist and musculoskeletal radiology. He is the world-known musculoskeletal radiologist from Malaysia. He had an advanced training in minimally invasive spinal neuroradiological intervention. He also clinically focused on advanced musculoskeletal diagnostic work, which interprets complex and advanced musculoskeletal imaging, which includes ultrasound, CT scan, and MRI. And that was the musculoskeletal system, and here are my references. Thank you for watching.